In this video, I am giving you some amazing nursing school exam hacks to help you pass your tests, even if you don't know what the answer is. Most nursing students I've talked to don't know that these nursing exam hacks exist, so let's break them down so you can finally start passing your exams. Now hit that subscribe button and click the notification bell, and let's dive in. Nursing school exams are different than any other exam you've ever taken. There's 4 or 5 correct answers, but you need to choose the most correct one. Talk about stressful. But I have found that most nursing students do not know about these test taking tips and hacks that can make picking the correct answer so much easier. The NCLEX is created by the National Council of State Boards of Nursing, or the NCSBN. And here's the fun part. There's a pattern to how they ask questions. And today I'm gonna show you what some of those patterns are so you can identify it and pick the most correct answer. Now, if you're a Nursingsos member, make sure to log into your dashboard and click on the video that we have on this inside the bonus section. In that video, I go into a lot more test taking strategies than we have time to talk about today. And if you're not a Nursingsos member, what are you waiting for, friend? It's life-changing. The videos, resources, and support that we have for you inside the Nursingsos membership community will blow your mind. Click the link in the description to check it out. You are going to wish that you joined sooner. Now, the first nursing school exam hack that we'll talk about is if there are 2 answers that are the same or similar, they're both most likely wrong. This one trips up a lot of students because you'll think that if they're super similar, then one of them would be the right one. But that isn't true here. So if you get a question that asks what sign or symptoms you would expect to see in a patient taking XYZ medication, and one answer says low blood pressure and another answer says hypotension, both of those answers are most likely incorrect. So choose a different answer. This is because if both answers are basically saying the same thing, you can't pick 2 answers. So you're better off just eliminating them both and choosing a different answer. Now, on the flip side of that, if you see an exam question that has 2 conflicting answers, one of those is most likely the correct one. So let's look at the first example again. If the question is asking you the signs and symptoms of XYZ medication, and one says hypotension and the other says hypertension, then one of those answers is most likely the correct one. They're testing you to see if you understand the difference between those 2 terms and how they relate to the subject of the question, which in this case is XYZ medication. Now, the next nursing exam hack is going to change your life, but before we get there, I want to give a shout out to our YouTube comment of the week, which says, I got accepted into my ADN program that starts in January. I have binge watched so many of your videos and subscribed. Thank you so much for these videos. I am so happy our videos have helped you, friend. We really couldn't do any of this without your love and support. So keep your comments coming. Now, nursing school exam tip number 3 is rarely, if ever, call the doctor. Now, many times nursing school exams, you'll see a patient case scenario and it will ask you what your first priority action would be. One of those answers might be to call the doctor. This answer is super tempting because oftentimes the exam question will give you a whole case scenario of a patient who needs help. But when you're taking nursing school exams, it is rarely your first priority to call the doctor. So here's what I tell our students. When you see an answer listed to call the doctor, look for a nursing assessment that you can do. Oftentimes, when you see an answer listed to call the doctor, there will be another answer with a nursing assessment that you should do first. Like check their blood oxygen level, assess their blood pressure, or see how they're breathing. Think to yourself, if I called the doctor right now, what questions would he or she ask me? Ask yourself that question and look through the other answers. Would the doctor doctor need to know any of the other information before they could help the patient? If so, pick that answer because that would be your first priority. Now, the next nursing exam tip is to know what acronyms stand for and the alternate names of things. Now, nursing schools and the NCLEX love to test you on random alternate names for things. For example, did you know that the neurological condition called autonomic dysreflexia is also called autonomic hyperreflexia? So if you get that on your exam, you've studied all day and night for weeks, and then you get to that exam question that asks you about autonomic hyperreflexia, you might freeze up because you have never heard that phrase before. So it's really, really important that you know the alternate names for things so you don't get tripped up on your exam. Here's another example. Do you know what the purified protein derivative test is? You might, but my guess is that you've always learned about it as the PPD test for tuberculosis. But yes, it does have that big fancy name, purified protein derivative. So your exam might ask you what that is, and you need to know what they're talking about. So make sure that you study the alternate names and the acronyms or abbreviations for names too. Now in the next video, I'm gonna walk through the 3 things that I wish I knew before I started nursing school. I definitely wish that I knew these nursing exam hacks before starting school, but there's a bunch of other things that would have made it so much easier too. So I'm going to tell you what those are in the next video so you don't need to struggle as much as I did in nursing school. And make sure to like, comment, subscribe, and share this video with a friend. And now click on one of these videos right over here so you can keep rocking nursing school and go become the nurse that God created only you to be. I'll catch you in the next video, my friend. Take care. Bye-bye.